or that bike might be just a tool to get at the broader goal, which is truly something that fits under those DSM-5 criteria for autism diagnosis. So the providers that I work with that I see that are the most successful in getting their care plans approved are the ones who truly understand how to look at the DSM-5 criteria and build their care plans based on addressing the deficits that fall under those DSM-5 criteria. The providers that I see that are least successful in getting their care plans approved are the ones that start out with, we want to give this child a 40-hour-a-week program or a 30-hour-a-week program or a 20-hour-a-week program. Now, how are we going to fill it? It really should be the other way around. What are the child's deficits under the DSM-5? Where do they fit under the DSM-5? How can we address those deficits under the DSM-5? What kind of goals can we devise to address those deficits? Okay, we've got some good goals. Now, how long do we think it's going to take to address each of those goals? And then we build our hours from there. Those are the providers that I see have the most success and quite frankly have the best care plans and programming is the ones that realize that their care plans are clinical, and so they focus on those pieces in their health insurance funded parts. We do have a lot of providers that live in both worlds. They are contracted with school districts as well. And, a lot of our kids, they are kids, and their natural environment may be the school. And so there is no reason clinically not to have some services be provided in school if they meet medical necessity, as long as they do meet medical necessity. And that's the gray area that is difficult sometimes to tease out, and also sometimes difficult to appropriately communicate to medical directors so that it does get approved, because there's kind of this, everybody wants kind of an quick and easy hard line between what is educational and what is medical. But for our kids, there is a gray area. And for our kids, because they are kids, and part of children's natural environment is school, just like part of adults' natural environment is work, some of those services are going to overlap. And I think we have to learn to be okay with that and just be a little bit more rational about how we approach it and decide who's going to fund a particular part of the day. And so that's going to be an ongoing question.
Well, it's 12 o'clock. I didn't want to take away from you. Do you have a presentation first? Or?
I do, yes.
Sorry.
No, you're fine. You're fine. Are we waiting for anyone else? Or are we ready to get started? Okay, I kind of hear someone talking. Okay. So we're going to go ahead and get started, and I'll try to keep an eye on the instant messaging side of things here so I can make sure to address the questions that everybody has. Sorry, I'm getting a message that you don't see me anymore. Does everybody see me? Okay, people are saying they can see me. Okay. The person who couldn't see me, I think you may have dropped off because you were on my screen and now your icon is dropped off. So you may want to try getting on again. Oh, good. Okay, you can see me. All right. I'm going to start off just talking a little bit about the various funding sources for ABA that we have available to us in Indiana. And we touched a little bit on some of them as we were kind of doing our pre-conversation. First of all, everybody I'm sure is aware that we are an autism mandate state, the first mandate in the country, most comprehensive mandate in the country. Basically, our mandate is supposed to cover all medically necessary services without limitation to age, location. There are no location limitations in our law. There are no location limitations in Bulletin 136, which is our enforcement bulletin for our mandate. And the autism mandate covers those insurance plans that are state regulated, or what is also called fully funded, and and they also cover individual policies that are bought on the commercial market, and then any HMO that is doing business in Indiana has to also follow the autism mandate. The biggest carve out, or the biggest group of insured that is not covered under our mandate, are those companies, employers that are called self-funded or under ERISA, ERISA. And I've given our organizers a handout that you'll all be given access to that basically outlines everything I'm talking about. So you'll have something like this. So you'll have something that you can use later on after this presentation. But as I was talking about before, federal mental health parity law also in our state governs what should be happening health insurance-wise with people with autism. And federal mental health parity laws do apply to self-funded companies that are large group plans. So even though you're with an ERISA company that doesn't fall under the autism mandate, if you are with a large ERISA group plan, federal mental health parity law does apply, and there is a lot of growing case law across the country that has been, that courts have mandated that a certain company or a certain health insurer offer autism coverage and ABA coverage in their plan, because to not do so would violate federal mental health parity law. So that's kind of an evolving area, and I'm working with a few families and certainly looking for more to work with to approach their ERISA employers who do not have an autism benefit and talk to them about parity law and the requirements and encourage them to address that gap in their benefits. I'm happy to report, for example, that is starting an autism coverage benefit with no age limits and no visit limits or hour limits or dollar caps on their autism benefit starting this upcoming benefit year. So that's very exciting, and the bulk of those negotiations centered around non-discrimination and also abiding by federal mental health parity law. And so again, just to answer the question, that's Purdue University. Purdue University is going to be starting that benefit January 1st. And so I've been up there doing some parent meetings and helping them understand, helping parents understand how to access that benefit and use it appropriately. So that's exciting. So besides the autism mandate and then rights under federal mental health parity law, the other mechanism for getting coverage for autism treatment in Indiana is under the Affordable Care Act plans, or the Marketplace plans, or some people call them the Obamacare plans. So our Affordable Care Act plans must follow the Indiana autism mandate. So that means no age limits, no dollar caps. And the Affordable Care Act plan also has non-discrimination regulations that go along with it, that not only apply to the Affordable Care Act marketplace plans themselves, but also apply to many other types of insurance plans. So, for example, it may be considered discriminatory under some of the regulations in the Affordable Care Act plan to not offer autism coverage, or to offer autism coverage but only allow 60 visits for ABA for an entire year, for example. So we're going to see a lot more cases and a lot more appeals and a lot more litigation as these Affordable Care Act non-discrimination regulations go into effect in 2016 and 2017. So we're keeping an eye on that. So we have private health insurance under the mandate. We have the potential for coverage under ERISA plans under federal mental health parity laws. We have our Affordable Care Act plan coverage. And then I'll next start talking about Indiana Medicaid. But first I want to answer a couple questions that are coming in. Can I clarify what you mean by no age limit, no age cap? Yes. What that means is under our autism mandate law and also under the Affordable Care Act plans and also under federal mental health parity, a health plan cannot put arbitrary age limits on treatment for autism because it is a chronic condition. And they do not place age limitations on treatment for chronic conditions in the physical illness, medical surgical realm. So, for example, it would not be in compliance with the Affordable Care Act or with federal mental health parity if the health insurer said, we will offer ABA coverage, but only age 3 to 10. And after age 10, you cannot get any ABA. Or if they say, for example, that we'll offer autism coverage, but you can only have $25,000 worth of coverage for autism per year. Or you can only have $500,000 worth of autism coverage per lifetime. Those types of age caps or dollar caps would not be in keeping with Affordable Care Act regulations and the federal mental health parity. The Affordable Care Act plans are in open enrollment right now for next year. So if you are, obviously some of these, as I was saying, federal mental health parity laws are supposed to cover ERISA plans, but some of that is in the process of being worked out through the courts. So what does that mean for you January 1st? If you need your child to be covered January 1st, the courts and class action lawsuits and those kinds of things don't necessarily work quickly. And so if you are with a self-insured company and they do not currently have an autism benefit, by all means, I am happy to help anyone negotiate with their employer, but that does take time. And so one of your best options is to look at the Affordable Care Act marketplace plans and what is available in your county through that, because they do have to follow the autism mandate, and they do have to offer no age limits to treatment and no dollar caps on treatment for autism. And so those can be a very good resource for almost immediate insurance coverage for autism at this point if you don't have it available to you through your employer. I've worked with many, many families who have gotten Affordable Care Act plans for just their child to get coverage for autism, and it's been a really successful way for families to be able to get the coverage that their child needs. A couple of things that you really have to keep in mind with Affordable Care Act plans. If your child is going to be the only one on the plan, you can get a child-only plan, and that can be your child can keep their traditional waiver Medicaid. If your child is on Medicaid because of family income, they cannot have both. So you will want to definitely talk to a navigator about that. But if your child is on traditional Medicaid because they are on a waiver, you can have an Affordable Care Act plan. Some are misinformed and tell families that their child has any type of Medicaid and an Affordable Care Act plan, but that's not true. Our Department of Insurance has verified on at least 3 occasions that a child with a disability who has a Medicaid waiver can also have an Affordable Care Act plan. Now, if your entire family is going to be on an Affordable Care Act plan, you will have to talk to your broker and navigator very specifically about subsidies, because a child with autism who has an Affordable Care Act plan and traditional Medicaid cannot have a subsidized Affordable Care Act plan. So you want to make sure that you don't get caught in a situation where your family is getting a subsidized Affordable Care Act plan and your child with autism who has traditional Medicaid is also on that plan, there are issues about separating those subsidies. And so you're going to have to really work with a navigator to get that set up correctly so that a year later you don't get a bill from the IRS for a subsidy that you weren't supposed to have access to. And that has happened to a couple of families this year. So you want to be really careful about that, about the subsidies and not having a subsidized Affordable Care Act plan if your child also has traditional Medicaid. And have a question here about what does subsidized mean for ACA? For Affordable Care Act plans, what the subsidy means is that tax credit that you can apply for. When you apply for Affordable Care Act plan, it will look at your income, and it will look at your family size, it will look at what county you live in, and some other factors, and then it will determine if you are eligible for a tax credit that basically helps subsidize your Affordable Care Act plan premiums. If your child on traditional Medicaid would not be eligible for an Affordable Care Act subsidy. So if you get a child-only plan on the Affordable Care Act, you want to make sure that it is not subsidized if your child is also on traditional Medicaid. If your entire family is going to be on the Affordable Care Act, you'll have to work with your broker to determine what you should do about the tax credits or the subsidies so that you're in keeping with the regulations and not getting a tax bill later on. Another question here, if you get an Affordable Care Act plan for a child with autism to cover ABA, should you opt out of the employer plan for the child, or can you have both? It is my understanding, and I have also been told by the Department of Insurance, that your child can have both your employer's plan and a child-only Affordable Care Act plan that's necessary to cover ABA and cover autism. What's going to be a little bit tricky is which one is primary. And there really is no easy formula to figure out if the employer health plan is going to be the primary or the health plan that has to be billed first for your child, or if the Affordable Care Act plan is going to be primary or the first billed insurance for your child, because that varies policy to policy depending on the type of policy that your employer has. That's kind of one of the downsides to employer-based health insurance, is that a lot depends on what type of insurance your employer has negotiated for. So you have to really look at your policy closely. There is a section called Coordination of Benefits, and that section will help you determine which is primary and which is secondary. And so that would be a really good conference call to have with your broker, your HR person, and yourself to try and get that all figured out ahead of time, because it gets really complicated and tricky once the claims start rolling in, trying to tease that out, and it can really turn into being a mess, especially when you're doing ABA and that's something that you're doing every day. So strongly suggest trying to get that figured out ahead of time. I'm going to touch on and if I didn't answer any of the questions or need more information on some of those questions, just keep typing. People are doing a great job typing in, and I'm trying to keep up. These are all really good questions. I'm getting a lot of questions on Medicaid, so I'm going to switch gears for a minute to Medicaid. All carriers in traditional and managed Medicaid are supposed to be covering autism, including but not limited to ABA, under a program that's called, it's another acronym that actually I'll type out here in the message part. It's called EPSDT, and what that basically stands for is early periodic screening, diagnosis, and treatment. This program under Medicaid, it's across all Medicaid types. It was instituted back in the early 70s, actually, as a mechanism for addressing potentially lifelong disabilities among children. And so what it's supposed to do is, for all eligible children, if there is a condition that could potentially lead to lifelong disability, this EPSDT program was instituted to help get early screening, get early diagnosis, and also early treatment. And when it came to autism, a lot of our Medicaid plans have forgotten the T or the treatment part. And so that's the part that's being rectified right now. Because the science of autism treatment has evolved as to such that there are certain treatments for autism that are generally considered to be evidence-based and medically necessary, not only by the medical community, but also by the vast majority of states that have mandated coverage for ABA. Indiana, or not only Indiana, but Indiana and other states' Medicaid programs are catching up and trying to offer, or supposed to be offering services for medical treatment for autism. And again, that's including, but not limited to ABA. So as we were talking about a little bit in the pre-conversation, our state has put together a proposal to cover autism under EPSDT. And I have a question here. EPSDT applies ages 0 to 21. So anyone under 21, EPSDT applies. Over 21, then you get into the realm of regular adult Medicaid and the medically necessary definition for an adult on Medicaid. Under EPSDT, because they're talking about children and they're talking about trying to prevent lifelong disability, the definition of medical necessity under EPSDT is a little bit more generous than what you would typically see under private insurance or even Medicaid for adults. Because again, the whole purpose of the program is to try to prevent and to reduce potentially lifelong disabilities. So that's the goal of that program. The state's proposal had some age limits in it and also had some limitations on how the services could be provided, specifically limiting service provision to board-certified behavior analysts and potentially limiting some services by age. And so those are typically things that are not considered to be possible under EPSDT guidelines. They really look at medical necessity and their definition of medical necessity. And again, age 0 to 21, as long as you're in that age group, EPSDT is supposed to apply to you. So we haven't seen any official announcement about how specifically ABA is going to be covered under Medicaid in the future. And if everybody can just make sure that your microphone is muted, I think we've got some noise coming from a couple of participants. So if you can just make sure you mute yourself. Okay, great, thank you. So we're going to be really we've been trying to get information and trying to set up meetings to get information because it's something that's really going to require some parent and provider education, this benefit. But at the end of the day, the federal government has been very clear that this is an existing obligation of the states, and that interim coverage should be in effect while the state is working out their any kind of state plan amendment. So I always encourage families to make sure that if their child is on Medicaid and they want to try to get the services covered through Medicaid, to make sure that they talk to their provider about specifically requesting these services under EPSDT, because these services have to be requested under EPSDT. And there are certain code modifiers that go with those visits, and there may be certain code modifiers that would go with the ABA therapy provision under that. So you'll want to make sure that as providers are putting in for pre-authorization, for any services under EPSDT, that they're using those codes, and that they are specifically identifying that this is a service that's being requested under EPSDT. And I have in your handouts sent to you a sample of some language that can be used for not only a pre-authorization for services under EPSDT, but then also some language that can be used in an appeal letter should you get a denial for services under EPSDT. So that is available to you as well. I have a question. Will those over 21 be able to continue receiving ABA? That's a good question. Under private insurance, there is no age limits, and so as long as the treatment that the individual is receiving meets medical necessity, whether it's private insurance under the Indiana Autism Mandate or whether it's private insurance under federal mental health parity, no age limits apply to that. Affordable Care Act plan, no age limits apply, so appropriate medically necessary treatment over age 21 should be accessible. With Medicaid, that is something that is a little bit more in the realm of evolving. A person who is over age 21 would not have access to EPSDT services, but if ABA therapy were medically necessary and met the medical necessity criteria for that person's Medicaid plan, that is certainly something that could be prescribed and requested and sent into pre-authorization. What's interesting here in Indiana is now, for example, my daughter Gabrielle was the first child in the country covered for ABA under private health insurance, and she is now just turning 18. So we have it's kind of a new frontier in terms of autism coverage, because a lot of health insurance coverage has been in the past focused on intensive early intervention, which is only a subset of what ABA is. ABA is a treatment that is effective across the lifespan for autism. And so now we have children like my daughter who are becoming adults and still have medical level needs, still have clinical level needs, and how are they going to be covered? So I think that we're going to see another wave of test cases with treatment for adults. And I think that, quite frankly, I think that will be easier to win from private health insurance and from Affordable Care Act plans and under federal mental health parity than perhaps in the Medicaid system, because we still haven't gotten early intensive intervention right in the Medicaid system yet. You could argue we haven't really gotten it right 100% of the time anywhere, but we've made a lot more headway in private insurance than we have in Medicaid in general, not only in Indiana, but also across the country. I think we're going to see a lot of test cases and a lot of test appeals going on with the adult community now that our children who grew up, so to speak, under mandated health insurance coverage are now becoming adults. So I know that's a poor answer to that question, but that is kind of the reality. Is we're going to see that happening more and more as our ones who used to be little and started getting coverage under state mandates now are becoming adults. So I am actually looking for some adult test cases. So if you have an adult with autism who still meets medical necessity, please, and is having trouble getting coverage, please let me know. I'd be very happy to help, because I think that those are the types of test cases that are going to really help shape what happens with adult services under health insurance and under Medicaid in the future. The other, we talked about Medicaid in terms of EPSDT, and we talked about Medicaid in terms of the health insurance piece. EPSDT is part of that Medicaid health insurance piece that you may get with with the Medicaid waiver, Medicaid waivers are support services. They are not medically necessary services, but some folks have in the past used waiver funding for some components of behavior analytic services. For example, behavioral consultation services can be provided by a board-certified behavior analyst if they are a Medicaid waiver provider for behavioral consultation and behavior management services. And those are I see a lot of families who have older children using waiver dollars for some behavior consultation services that are a little bit more sporadic than maybe is needed when a child is doing an intensive behavioral intervention program. Behavioral consultant services, though, do not include the RBT. So just want to make sure that people know that. Can everyone still hear me? Okay, great. Good. Just wanted to make sure. There is some language within our Medicaid waiver plan that does allow for intensive behavioral intervention services, but they are limited, I believe, by age 0 to 5. So we are, and that was instituted back when there was a 10-year to 15-year waiting list, and so no one was really accessing those intensive behavioral services under the waiver because before you got on the waiver, you were already aged out of that service. But we are having children younger and younger getting on our waiver programs. And so that may be something that is accessible to some of the younger children now who are getting on the waivers at a younger and younger age. And we keep hearing at the ARC, we keep hearing this rumor that you can't apply for a family supports waiver until your child is 6 years old. That is not true. If your child is diagnosed with a disability at any age, you can apply for a family supports waiver. Obviously, you have to go through that process. You have to get approved, and you have to get services set up. But there's no hard and fast rule that your child has to be age 6 before you can sign up for the family supports waiver. So we encourage families to sign up as soon as they can, because there is still, while a lot shorter, there is still a waiting list, and it offers you a little bit more options because it is support services, not strictly medically necessary services. So there's respite involved, or music therapy, recreational therapy, things that private insurance are not going to cover because they don't rise to the level of medical necessity. So definitely make sure that you sign your child up for that, because then it does also give you access to Medicaid if you otherwise are not eligible. Children's Special Health Care Services is also another vehicle where some families have been able to get some coverage or some coverage assistance for ABA. But I think that we have to be realistic about what the Children's Special Health Care can do. It is limited by dollar amount that can be utilized by each individual. And it is truly intended to be a supplemental source of coverage, or a coverage supplement. It's not supposed to be a main a source of coverage. And the coverage is limited by the child's primary insurance has to be billed first. If the child has Medicaid, the child's Medicaid also has to be billed first. And then Children's can help cover things that aren't covered by the child's primary insurance or the child's Medicaid, but those have to be billed first. And Children's Special Help is limited to 23 specific conditions, but that does cover over 500 different medical diagnoses. So it's not just a supplemental coverage program for people with autism. It's for all children with special health care needs. And so they have a lot of different conditions to cover with some limited resources. So we want to make sure that that's a program that we may use appropriately. Children's Special Health Care will reimburse for one-to-one BCBA or BCABA services only. They are not reimbursing at this time for registered behavioral technicians. So you'll want to definitely keep that in mind when deciding whether or not you want to apply for that. There is an application process, so you have to have that. And then there have been some rumors that Children's Special Health can be used to pay Affordable Care Act premiums. That is not true. Children's Special Health, I had an email exchange with their director, and they do not help cover premium payments, but they can help. They do help with copays, and they do help with certain other types of services that that private insurance and Medicaid does not cover. They also do not cover cover deductibles in full. If a child has Medicaid, Medicaid is supposed to help cover deductibles and coinsurance and copays. So if a child has a primary private insurance and Medicaid, you'll want to work with your providers to submit the deductible and the copay expenses to Medicaid for coverage for that as well. So that's Children's Special Health Care Services. There are also some grant programs out there that some families have been able to access to help cover some costs related to ABA therapy. United Healthcare has a grant program that there's always an application process, and most grant programs are limited to services that you are going to seek. I frequently get calls from families, I incurred a $6,000 deductible this year. I want to apply for a grant to pay for it. They typically will not pay for past medical expenses. So, if you have a large deductible and you know that's going to be an issue for your family and you don't have Medicaid or other options to help pay that deductible or co-pays, you want to make sure to apply for these grants ahead of time, not after the costs have been incurred. Some providers will work with families who have financial need to establish payment programs where you can pay your deductible in smaller pieces over the course of the year as opposed to upfront. So definitely talk to your ABA provider about that. Different providers obviously have different programs. Some do not do that at all, and some have kind of a regular assistance program set up. So that varies provider to provider. But one thing to keep in mind is your deductible and your copay. That's a contractual obligation between you and your insurance company. So your provider, if they are an in-network provider with the insurance company, they are barred by their provider contract to just completely write off deductibles and copays without any attempt to collect them and without any attempt to establish a payment program. Now, that is not to say that they can't forgive some and that they cannot work with you to set up a payment program, but they cannot, as a policy, just completely write off all deductibles and all copays. There has to be some give and take there because that is a contractual obligation between you as a subscriber and your insurance company, but then also the provider is contractually obligated to collect those. So keep that in mind. I have a question here. We often have families from rural areas driving pretty far to receive ABA services. Can you use children's, and how do you set up Medicaid to reimburse for transportation? That is a very good question. My forte is much more in private health insurance. I do know that there are definitely ways to get transportation reimbursed under Medicaid, and I would have to defer to my colleague Carly at the ARC. She is just an expert in all things Medicaid and all things Medicaid waiver. But there is definitely a way to get transportation assistance with Medicaid. As far as Children's Special Health, I honestly don't know if they help pay for transportation, but that is something that I can definitely ask their director directly and get some information on that and communicate. And Patty is saying here that Children's Special Health has information on their website about how to get reimbursement for transportation. There is a specific form that you need to complete for that. So thank you, Patty. Yes, children's can help. I love these group events where I learn so much too. I learned as much from you as I could ever hope anyone could learn from me. So thank you, Patty. Yes, children's can help with transportation as well. And that is a great thing to apply to children's for, because typically transportation is not covered by private insurance companies at all. It's just not something that's covered under private insurance. So that is definitely something to look to Medicaid or Children's Special Health to assist with. I do know that with Medicaid, and I'm sure I do know with Medicaid that if you're going to be using a transportation company, there are scheduling considerations and provider considerations and county considerations. So I would suggest that if you have Medicaid, that you contact your case manager and work with them to set up the appropriate contacts with providers who do transportation to make that happen. And then children's, Patty, I'm going to kind of put you on the spot a little bit. Do you know if children's will reimburse a private car to, let's see, Children's Special Health will pay for they'll pay for transportation, but not if the family has Medicaid, because again, they want you to use your Medicaid first and use them as a last resort. It says that there are some forms to fill out, and thank you for all of that information. That is really, really helpful. Okay. Yeah, transportation is a big issue, especially in a state like ours where we have a lot of families out in rural communities, and it's very hard to access. And so that is great information to share. Thank you very much for that. In terms of the other ways to fund ABA programming on the educational side, not on the medical side, but on the educational intervention side, some school districts have hired board-certified behavior analysts to consult with teachers. So I encourage families to ask in their school district if they do have a BCBA on site or in the district, and what, can they be included in the IEP process and as a consultant to their teachers. Some school districts will collaborate with outside agencies to provide ABA therapy, either in the school or as an outside placement outside of the school, especially if there are behavioral issues that are really interfering with the child or even young adult being able to participate in a building-based school program. But it's really important to remember that schools are not necessarily going to write any particular intervention method into an IEP. So you're very rarely going to see an IEP that says ABA therapy, and that is written into the IEP. However, if ABA therapy and training in ABA intervention tools is needed for a child or young adult to access their education and to be able to progress and to be able to achieve a free, appropriate public education, then certainly that is something that should be on the table for the case conference committee to consider and to talk about. But keep in mind that public schools do not treat medical conditions, and IDEA does not require the public schools to treat a medical condition or to provide clinical level intervention for an individual. It requires services that will allow the child to access the state curriculum, to access their education, and to access a free and appropriate public education. So that standard is different than the standard for clinical intervention and the standard for what insurance will reimburse and what insurance is required to provide. Also governed by totally different laws, governed by IDEA and governed in Indiana by Article 7 in IDEA. So always encourage families to get as much training and information on IDEA and Article 7 as they possibly can. An area of case law and litigation that's also starting to, not starting to, but it is increasingly being seen across the country, is the issue of schools cooperating with medical treatment and allowing clinical providers who are providing ABA services to do so on school premises and during school hours. And in these types of cases, it's argued that the schools should, and in many ways are obligated by Americans with Disabilities Act to cooperate with the provision of medically necessary treatment during school hours and in the school setting. So if your child is doing a clinical medical ABA program and some of that clinical level services need to be provided within the school setting because it is the child's natural environment and because that is the setting in which those core deficits express themselves, there should be an openness to cooperation to make that happen. And those are some of the types of cases that we're seeing happening across the country. So certainly school-based intervention for ABA tools and ABA educational intervention is, certainly one option for funding for some ABA-based intervention, but that would not be necessarily the clinical piece. But I think that parents should have an expectation of cooperation and collaboration on both parts. The school personnel, the clinical providers, and the parents should be on the same team together, working for the child's progress across their entire environments. And so I think that is going to be a real evolving area in our state, especially with Medicaid treatment for autism and the state beginning to comply with those requirements. I think we're going to be seeing a lot more conversations about how ABA can be delivered across those funding streams in the most appropriate way. Some states have actually put in putting together their EPSDT programs, actually created a committee that involved not only Medicaid personnel, but also medical personnel and Department of Education personnel, so that they could work out up front how these relationships and responsibilities should work. And so I'm hopeful that maybe we can see that be something that evolves in our state as well. So I have a question here. I guess we had a little trouble with the audio. Schools are not obligated to provide medically necessary services like ABA, like speech therapy, occupational therapy. They are not required to provide medically necessary services. They are not required to provide clinical level intervention. They are required to provide what is necessary for a child or young adult to access a free, appropriate public education. And that may, in some cases, mean ABA within the school by an outside agency. That's a case conference committee decision that needs to be individualized. What I was also talking about is there's kind of a growing case law about public schools saying we will not allow any outside agencies to come in and provide ABA within the school building, even though it's medically necessary for that child to have clinical ABA therapy provided in the school setting, because the setting, when it comes to ABA, sometimes the setting is an actual component of medical necessity. Sometimes it is medically necessary for the services to be provided in school because the child's core deficits of autism can only or can mainly be ameliorated in that setting because they express themselves mostly or mainly or even exclusively in that setting. And so it's really we're going to have ongoing conversations about how medical personnel, clinical personnel, and parents and school personnel can work together to make these programs work, because we can't divide our children and our young adults up. Part of their job is to go to school. A lot of their lives are spent in educational endeavors in school, and school is not only about education. School is a huge social opportunity. And one of the main deficits in autism are all of those things that happen in school socially, not just academically. And that's a big area where a lot of clinicians want to go into the school setting and help their client or patient or learner with those social issues that are at a clinical level. But really, the education setting is the only place available to really work on those in a way that's natural. And of course, there are lots of other scenarios where it could be medically necessary to provide services actually in school. Again, kind of a case-by-case thing. But to have a hard and fast rule that clinical services can never be provided by the clinical team in a school setting and vice versa just doesn't recognize the reality of autism and what children's lives are like and what children need to work on. So with that, I'm trying to check my time here. We have about 10 minutes. No, we have about 5 minutes left. So I wanted to take any questions or if there's anything I can clarify, just type at me or unmute yourself and let me know. And while I see some people typing, while people are typing, another one of the resources that I've given to our organizers, it's going to be hard to see on here on my little screen, but it is comparing health insurance plan options for private ACA or Affordable Care Act plans or employer-based plans. This is a health plan comparison worksheet that actually my husband and I use to compare our health insurance options. It's kind of a compilation of something I found on the Affordable Care Act website, and then took the comparison chart that my husband and I developed and kind of put them together so you can, on one piece of paper, look at your options about premiums, deductibles, out-of-pocket maximums, copays, what types of medications are covered, other services. So you can really do a
So the person on the phone, I have to cut out because I have another webinar that I'm doing. Is there anything else you need? Do you have any questions?
Questions. So are most ABA providers expected to accept?
Well, if not, have a good one. Thanks. Bye.
Medicaid, has this existing obligation to cover ABA, which is going to include in it an obligation to have accessible networks. And there are certain, not regulations, but certain parameters that health insurance plans